Let's turn now to our series on the search for solutions when it comes to the battle against the coronavirus. With partial reopenings underway in 36 states and 5 others making plans to do the same, experts are concerned about what that will mean for the spread of COVID-19. Dr. Tom Frieden, director of the CDC in the Obama administration, testified on Capitol Hill yesterday and had a dire warning.
There will be, tragically, at least 100,000 deaths from COVID by the end of this month. Second, as bad as this has been, it's just the beginning. Until we have an effective vaccine, and unless something very unexpected happens, our viral enemy will be with us for many months and possibly many years.
Dr. Frieden is with us this morning. Doctor, good morning to you. I mean, I just heard those words. They really hit you. 100,000 deaths by the end of the month, having this virus with us months, if not years to come. And at the same time, we are starting to see states reopen and feeling really desperate to do so given the dire economic consequences that are really coming home. How should people be thinking about this? Because it seems like on the surface, a disconnect.
Savannah, it's such an important question. There's a false dichotomy here between public health and the economy, open and closed. Actually, it's not going to be going back to normal anytime soon. It's going to be going to a new normal. And it's more like a dimmer dial than an on-off switch. There are lots of things that we can begin to do carefully, safely in new ways. That includes going outside to parks, safely to beaches, as long as we're not overcrowded there, and as long as people don't congregate afterwards inside somewhere else. And we need to think about what parts of our economy are particularly open, particularly strategic to reopen carefully. There are things that we can do with hand sanitizer, face masks, physical distancing. The more we get our economy restarted and our healthcare system restarted, the healthier we'll be. And the more we control the virus, the more we can control the economy. We're all in this together, but we have to avoid rekindling an explosion of coronavirus that would overwhelm our healthcare facilities and result in avoidable suffering and death.
Yeah, I wanted to ask you about that because we are all watching so carefully and with bated breath as the states start those ginger steps towards reopening, some more aggressively than others. For you, as a public health official, what are you watching right now? What's the sign for you that the reopening has led? We all know there are going to be more cases when you reopen somewhat, but that it's gotten to be out of control. What's the metric and how soon would you expect to see it?
Well, first off, we have to recognize we're still having a lot of spread, and particularly in what we call congregate facilities, nursing homes, prisons, jails, homeless shelters, packed workplaces with lots of people together. And those are driving spread, not only there, but throughout communities. So we've got to get a better handle on that. I'm also watching to see how quickly states and localities can ramp up contact tracing, because that's a way of keeping people safe. If you warn people they've been exposed and they quarantine themselves, they're less likely to go out and spread it among others. This is an effective way that other countries have used to keep their economy moving. And we need to scale that up because so much depends on it, lives and livelihoods. But the things that we look for, first, recognize it's going to be weeks before you see a lot of spread, if there's a lot of spread today. The disease takes about 5 or 6 days to make someone sick and another week or so to make them very sick. So it'll be a few weeks after reopening if there is a big resurgence before you see it. The problem is that once that starts, if it really picks up, it's very hard to stop again. One of the things that we look at are visits to emergency departments for people with cough or fever. Another thing is some of the feeds from new data streams like Facebook, which is asking people, do you have cough and fever, in an anonymized way. That information is available, and it seems to correlate pretty well with how much viral activity there is. You also want to make sure that the healthcare system is getting safer. No healthcare worker should have to risk their lives to care for us.
I only have a few seconds left, but you wrote in the New York Times in an op-ed, we need to continue physical distancing until we reduce new cases to a manageably low number, flattening the curve so we're at a simmer, not a boil. What does a simmer look like in this context? I mean, in terms of the number of cases and sadly, the number of fatalities.
What we hope is that we can protect the most vulnerable. If you're over the age of 60, if you have underlying health conditions such as diabetes, heart disease, lung disease, you need to continue to stay as far away from others as possible and keep yourself safe. We need to make our nursing homes much safer, address the outbreaks we're seeing, strengthen our healthcare system so healthcare workers aren't at risk. And if we box the virus in by testing, isolation, contact tracing, and quarantine, those four corners of a box, we can keep the virus in a limited way so that we can come out more safely.
Yeah. Former CDC Director Tom Frieden, it's good to get your perspective and your thoughts this morning. Thank you so much.